Interviewing amount of menstrual bleeding, we have a case history of a 49-year-old woman who had been suffering from menstrual flooding for 11 years. Since the birth of her second child when she was 35, her cycle had been irregular, varying in length between 17 and 45 days. The period lasted 7 days in total and was painful. The menstrual blood had clots, and she had a brown discharge for 1 day after the period. Her periods also had been painful in the years following menarche at 12. Her gynecological history was rather complicated as she had been on the contraceptive pill from the age of 18 to 30. She had a miscarriage at 30, the first child at 31, another miscarriage at 34, and a second child at 35, and the periods became very heavy at 38. In complicated history such as this one, it is helpful to draw two diagrams, one outlining the main gynecological events of her life and the other depicting the menstrual cycle. So apart from the gynecological problem, she has had difficulty in bladder and bowel control since the second pregnancy. Her pulse was slightly overflowing and rapid and very weak on both rear positions. Her tongue was red and slightly purple. So here we have the organs influencing the areas of the breast. So we have the liver and gallbladder, the stomach, and we have the penetrating vessel. The menstrual flooding is caused by blood heat, which is evidenced by the red tongue and overflowing rapid pulse. There is also some blood stasis indicated by the painful period, menstrual clots, irregular cycle, and slightly purple tongue. There is also an underlying kidney deficiency, which is indicated by the weakness of the pulse in both rear positions and by the fact that the menstrual flooding started after the second childbirth and she had 2 miscarriages. The treatment principle is therefore to cool blood, stop bleeding, invigorate blood, and tonify the kidneys. In gynecological problems, it is often appropriate to apply different treatment principles in each phase of the menstrual cycle. There are 4 phases in the menstrual cycle, the first being the period itself, during which blood is moving, the second being the postmenstrual phase, during which there is a relative blood deficiency. The third being ovulation, during which the penetrating and directing vessels are active, and the fourth being the premenstrual phase, during which liver chi moves. In this case, we can therefore cool and invigorate blood during the premenstrual phase and the period itself, and tonify the kidneys after the period for about 2 weeks. Thank you for your attention.